So what do you think about people taking melatonin as a supplement?
You know what? I used to be like so against it, and I'll probably get cruises people coming for me. I think that a lot of the studies, and Russell Ryder is really a great one to look into his work around melatonin. I think a lot of the studies done on melatonin are very interesting and compelling. It's a master antioxidant, but they weren't done where people are optimizing their circadian environment, because if there's blue light, you can't make melatonin. If insulin is up, you also can't make melatonin. If dopamine is up, you also can't make melatonin. So there's a lot of other factors. And we actually, in UVA, is when the body synthesizes serotonin, which is recycled into that night's pineal melatonin. Another thing about melatonin, you can make it subcellularly. The mitochondria make it in response to infrared light. So sitting in front of a red light panel or just going outside in the middle of the day, it's like 42, 43% of the sunlight that's available, even a cloudy day, helps your body to make subcellular melatonin. So it's kind of like cleaning up little messes all day so that your pineal melatonin doesn't have to work as hard at night to do this repair and cleanup. So, you know, if someone wants to take melatonin, I think they should work with a practitioner to use it at a very low dose and only in like acute situations. I think it could be very helpful if somebody has an infection, virus or something, some major illness, cancer. I think it can be really a helpful thing for people to add in, but it needs to be pulsed, and I think it needs to be at a low dose. So I never say never, but yeah, the
I
long
completely
answer.
agree. I completely agree with everything you just said. And I have lots of reasons for it too. And I completely agree with you. That's how I've been practicing for the past many decades. And I'm not a huge fan of it at high doses. I'm not a huge fan of it
Mm-mm.
all the time. You can really get in a lot of trouble. I want to shriek in horror when I hear people saying they're giving, 50 milligrams a night to their kids. I'm like, oh
Oh my
no.
God.
And it only really
Maybe if your kid
comes,
has a brain injury, I mean,
right.
but
It only comes in high, generally, I should say not only, it generally comes in very high doses from the health food store or wherever you're getting
Mhm.
it. And so I've always stocked like 1 milligram tablets in my clinic. And I've heard so many sleep doctors talk about this. If you're going to take it, you want to, I mean, to go with your light conversation, you actually want to take it when the light starts dimming. That's when your
Mhm.
melatonin pulse is supposedly strongest. From what maybe this information's been updated and I'm wrong, but somewhere around that like 7 o'clock, I guess it depends on the time of the year and when the light's going low in
Mhm.
the sky, but taking it earlier in the night is, from what I understand, more critical, and tiny little doses that would be more matching
Mhm.
to what your body would create, not these super
Mhm.
physiologic well, here we are having the conversation about super physiologic doses again, like we did on your podcast when I was talking about GLP-1s. Like I just am not a fan of anything at high
Yeah.
doses. And you get
Yeah.
into trouble. So really matching that pulsatile window of your melatonin, I think, is so important. But I love what you just said about all the daytime things that need to be in check. I got my Dutch
Mhm.
test back in 2019 and my melatonin was completely bottomed out. And
Mm.
I was like, damn, I need to change my life up. Like that's really the first thought I had, was like, that was the most concerning lab. I've gotten some concerning lab results, and that was probably one of the most concerning ones, because if you're really low in melatonin, like you're looking at cancer. So
Yes.
I was
Yes.
like, oh, geez, my life is all screwed up. I wasn't
Mhm.
thinking like I should go supplement melatonin at night. I was like, I got to get my shit together. I
Yeah.
got to get my
Yeah.
daytime. I was traveling a lot for work then. I was tremendously stressed out. I was having some pretty serious issues with my family and my daughter and my relationship. And, everything was going to hell in a handbasket. And it had been for a couple of years. And so that was one of the big signals for me to change my life completely. It was one of the big reasons I actually left my practice, Sarah. Like totally
Yeah.
honestly, that
Yeah.
melatonin, I haven't retested it. I probably should. I didn't want to know. I'm sort of at that place where I'm like, I'm just going to keep trying to do my best.
Yeah.
Listen to
I
smart people
mean,
like you. So,
well, I mean, sometimes we get like a sign that it's like, my infertility issues were they were horrible. I don't want anyone to ever have to go through that sort of thing, but it was like something has to change.
mhm.
I have to start doing something different, because this diet only approach, the way I'm living my life, it's clearly not working. Right. And just like the weight loss thing wasn't enough for me. It was like, I really want to have this baby. And so I have to figure this out. And the beautiful thing is that I changed the way that I started at that time, even in 2021. I started changing the way that I was talking to the women who were coming for health coaching, for nutritional counseling as a nutritionist. I changed all of that back in 2021. They started having amazing results too. I mean, my whole group went from let's all food to like women are posting pictures of themselves like barefoot. They're posting sunrise pictures. I had this ice vest that I was using for a little while for cold therapy. They're like posting pictures on their ice vest, and it just got to be hilarious. And we still have a lot of fun in my group. It's funny. It's really funny, but just that fundamental change that happened in 2021 for me because of not being able to get pregnant ended up being a spark that shifted the way I look at everything. And then also my ability to help other people. And it was scary to shift away from the whole carnivore thing because I had really kind of grown through that, but it was no longer serving me. I'm sure it was kind of the same with your medical practice. It's like, this is what I've built my whole life around.
Mm-hmm.
And I've got this warning sign, this signal here that things are not optimal for me. And if I keep going down this road, it could get worse. Right.
Oh, for sure. It's that big flag, like something has gone wrong in the environment. Change course,
Yes.
and seeing that melatonin reading. And I do take some supplemental melatonin here and there as needed. I probably could be a little more strategic with it, but you're spot on. It's all the daytime stuff. That's it. And if your serotonin's all screwball, you're not going to make your melatonin, and you're just taxing your poor pituitary gland anyway, which is already being hammered on by life and toxicity and just everything else in the world, the common, the modern world. So